This is the online video tutorial for Fotona UK and Ireland. It is used to complement the hands-on manufacturer training in conjunction with the Fotona training booklet. This is aimed to be a refresher and cannot be used as an alternative to the hands-on manufacturer training supplied by Fotona UK and Ireland. To perform the Fotona NightLase treatment, you'll be working in 4 key areas: the anterior pillar, the soft palate, the posterior pillar, and the uvula. So starting on the anterior pillar and soft palate areas, you will get some elevation and initial tightening, which will help you with visibility and access to the posterior pillar and back of the mouth. And you'll be aiming to achieve about 2,000 shots per treatment, working in 3 to 6 stacks. This will depend on your patient's tolerance. You can see here where the laser is being aimed, and a spatula is being used to help to lower the tongue. You can use retractors, or simply asking your patient to say "ah" will help elevate and give you better visibility. To find your NightLase presets, you will go to Twin Light on the interface and click on NightLase. What we'll be using today is the PSO3X, which we will attach to the erbium arm, like so. We'll also be using the metal adapter, which simply clicks on to the end there. So going back down to the interface, you have got low brushing, low stacking, high brushing and high stacking. So we will be working on the high stacking, and it will take you through now to set your parameters. Ideally, we would like the patients to get up to about 9 joules, but depending on their tolerance, it can be reduced all the way down to 7 joules if necessary. The speed will be set to 2 Hertz, and we would like stacks of about 3 to 6. Again, this will depend on tolerance. The amount of stacks can be reduced if necessary. This is a stack counter, a pulse counter, that can be used to automatically stop and start your foot pedal. If you are happier counting by yourself and you don't need the laser to assist you, you can frost out or freeze out that counter, like so. When you're happy with everything, press and hold, and then just confirm your spot size as normal. For the Fotona NightLase treatment, you'll be using the PSO3X on a 7mm spot, working with the energy settings set in your protocol booklet. So you'll now ask the patient to open their mouth, and you should be able to see the soft palate, the anterior and the posterior pillars, and the uvula. So starting with the anterior pillars and then working onto the soft palate, you'll be directing the laser beam in a nice perpendicular way onto the tissue. Try not to angle the handpiece too much. You want a nice clear circle shape. And here we go. 3, 2, 1. You can ask your patient, as you heard my model do there, is to make a nice clear R sound. This will give you a little bit more visibility when you're working there. So here we go again. Nice big R. And you're aiming to do between 3 and 6 shots in each area. Now, you may want to offer your patient regular breaks, just because there can sometimes be a little bit of saliva build-up, or as the heat builds, they may just need to have a little rest. So allow your patient to have these breaks if they need them. So once you've worked on the 4 areas that's stated in the animation video, you can repeat that process, and you want to be doing about 2,000 to 2,500 shots per treatment. Please refer to the training booklet where you will have further information on treatment protocols and device presets.